are 2 arteries and 1 vein. It is very important that, even when the baby's born and the cord is cut, that nurse is assessing to see if there's 2 arteries and 1 vein. So if there's not, then you may be looking for the baby to have maybe some congenital defects. So you want to make sure, and you know what the reason why we have arteries. They carry blood from the embryo to the villi. Remember that chorionic villi? That has to have lots of oxygen there. And then it returns, and then the vein returns blood to the embryo. Arteries away, veins too. Do you remember that? So it has 2 arteries and 1 vein in the umbilical. Oh, Lord, mercy. All right. One of the percentages, I don't like percentages, but I thought this was really, really neat that only 1% have 2 vessels, which I thought that was pretty interesting. I thought it would have been a more higher percentage, but it is not. And then that may, like I said, that congenital. I want to talk to you a little bit about knots that happen in utero. Usually, we have enough cushion and enough fluid in there, the amniotic fluid, that the baby doesn't get, or the umbilical cord doesn't get knotted. But there are times that babies can do somersaults and actually get true knots in the cord. And generally, if it's a true knot, babies don't generally survive with a true knot, because if that knot is tight, think about what's happening. You got your 2 arteries, you got your 2 veins, it's got a true knot, it's cut off, there's no blood supply to the baby, getting O2 or any being taken away. So it's very, very rare that you see a true knot. And it does, now it can be tied and not, and be loose and be okay.
That's what I had.
Did you have a true knot?
No, it was just loose. I mean, it was a knot, but it was loose.
Yeah. But the true knot means that it's altered and it's tight. So the circulation is completely cut off. So baby cannot survive if that happens. And we have a lot of active babies that like to roll around inside of there and get all tangled up. And sometimes what happens is that the babies get the umbilical cord around their neck. That is called a nuchal cord. When it's around their neck, it's called a nuchal cord. If any of you have seen deliveries, and when they pull that head out, one of the first things that they do is they stick their finger around the neck to see if there's an umbilical cord there. And if it is, they will take it and pull that cord out from around their neck when they're born. Yes.
So my brother had that, and my mama had like this much of his head out, and his heart rate dropped, and the doctor shoved him back in.
Shoved him back in because he wanted to make sure that he could get that,
Mm-hmm.
that cord in a controlled environment. Okay, he wanted to make sure that it was controlled, so they shoved him back in. Then they can control the head coming out and making sure that there's no cord around their neck. And yes, babies do show us signs and symptoms of a nuchal cord on the strip. And I'm not going to strips with you, although I would love to. I love these strips, but I won't do that. But you also have to, it can be a nuchal cord times 1, times 2, times 3. So it can, depending on how many times that baby does in somersault, you can have that cord around the neck several times. So it is vital that when that baby's delivered, that we make sure that we've checked that cord before they're delivered to make sure that there's no cord around the neck. The Wharton, this, I told you the other day that one of the biggest things with this, section is a lot of terms that you're gonna have to know and learn because they're normal and abnormal. And most of them are normal things that you see with a pregnancy and normal things that happen. Nuchal cord is not normal. Oligo, poly is not normal. Umbilical cords are normal. But Wharton's jelly is like a connective tissue that is on the cord that helps it, and that is a normal thing that happens, the Wharton's jelly. And what that is it makes it from a cyst. I would say it's all the time, but it assists from it being compressed. Because if it's compressed in any way, the blood supply to the baby can be cut off. That's why a lot of times when, quit.
With like the nuchal cord and then the oligo and the poly, are those all like, if you see them in like the mom's first pregnancy, it's common to happen in the second pregnancy, or it's just stuff that happens?
It's just stuff that happens. Yeah. Sometimes you see poly in following pregnancies. Oligo, no, because it's more of a renal issue. And just because you have one child who has a renal problem doesn't mean you're going to have the second one. Nuchal cords just means you've got one that's active and they're doing somersaults in your belly, but they check for every birth. They check for nuchal cords. As soon as that head comes out, they're checking for that nuchal cord to make sure that it's not there. I can't hear you, babe. You got to talk up.
A cyst.
Oh, it assists, yeah, it keeps it from not being compressed. Does that make sense? Oh, I wasn't saying a cyst. Oh, I just knocked off my sheet. Yeah. Okay, yes, yeah, no, it's not a growth. What it does is it just helps it from getting compressed. Because a lot of times babies, the cord can get down and they can sit on the cord and compress it. So when it's compressed, that means that the blood supply is being decreased. And so my baby's not getting perfused enough. I've even seen on ultrasound babies take the cord and squeeze. Hang on to it and squeeze it. So it's a lot of, that jelly is designed to not get it compressed, because we know that perfusion has to happen, and if it's compressed, then no, we gotta get rid of it. One of the biggest things that you'll see, and you'll hear even in preterm labor and moms when babies start showing out, I always say they show out when they show me things on the monitor that they're not looking very good. One of the biggest things is you'll turn your mom to the left side, because that will increase the circulation and increase the perfusion. We'll talk more about that left side later. Oh, Lord Jesus, I can't even do this thing. I'm going backwards. Alright, so going on to twins. Our twins, the process of division of cells happens the same way when let me just say, the sperm and the ovum together, all that happens the same way. But when you get to developing twins, it has to do with when the division of cells occur to what type of twins you're going to have. Does that make sense? So within the 4 days, when that breaking or when that conception occurs and the cells begin to divide away, if the division begins at 2 days, then at 4 days, we're gonna have 2 embryos, 2 amnions, and 2 chorions. If the division began at 4, in the stages at 4 days. From 4 to 8 days, you'll have 2 embryos with 2 separate sacs. So they will be totally on their own. And if the division occurs between 8 and 12 days, you'll have 2 embryos with a common sac and a common chorion. So it has to do with the division and when it happens, and the cells start dividing. Okay, identical twins are monozygotic twins, and they are from the single fertilized egg. It's usually the same sex, and they have the same appearance. Identical twins usually have the same placenta, so there's only one placenta there. And they have the same the 2 babies have the same characteristics. And that is monoidentical. And I just put a little picture up there for you. As you can see that there's just 1 sperm and 1 egg. And then when it starts to divide, you get 2 amnios and 1 chorion with identical twins. And then the fraternal twins, there's 2 separate eggs fertilized by 2 separate sperms. So they're 2 separate people. Not that twins are not identical or 2 separate people too. But there's 2 different sperms that have fertilized 2 different eggs. So there's 2 placentas, 2 chorions, 2 amnions, and they may or may not be the same sex, and they don't really look alike.
So, I think I can say this since we're up in class, but I took care of a mom once that had twins that had different dads.
That can happen because they are fertilized by 2 separate. They're their own little people.
There's a Wendy and a Wendy.
Yeah. Yeah.
So that
I have
was
seen
outside
that.
like quickly.
Yeah. Because you remember sperm doesn't last but up to 72 hours. So she would have had to have had intercourse with 2 different people very close together. Yeah. Yeah. So.
This one's for you. This one's for you.
Spit it out.
In the video that we were watching, whenever it said like 1 sperm gets to the egg first and then it like pulls something out, they just get to the egg at the exact same time.
No, they're actually 2 different eggs.
Okay.
So they're an egg here and an egg here, and then this sperm goes here, and this sperm goes. This sperm from John goes here. This sperm from Mark goes here. So you gotta.
That's why I was thinking it's the same egg and
Because really, that's the only. I mean, it's just like an individual pregnancy.
But then for fraternal, it's two
But
eggs.
paternal is 2 different things.
I'm seeing for identical, I guess. If do 2 sperm just get the exact same time?
No, it's just they break. It's 1 sperm, 1. And they just the division of it makes them identical twins.
So in that case, they can't be identical. They're 2 different
Right.
baby daddies.
Yeah, they're not identical. No. No, they are not identical. They are 2 separate. That's why their characteristics don't look like identical.
It's just like she's holding 2 babies in her sack.
Absolutely.
Yeah.
Absolutely.
They still have
Yeah,
different sacks, though,
identical usually
even if
runs
they're
in family,
identical,
usually
right?
skips a generation.
Because it's
Skips a generation.
it's one
No, maternal doesn't have any.
okay, so
They're identical. Absolutely. They look just alike.
the placenta. Yeah. I get the placenta. The sacks was wrong.
But you know how you take medicine to get pregnant?
Uh-huh.
And so if you take that, and you know how some people end up with twins, that's how I was doing. So, or does that mean still skip a generation or no? Does that not count? 'Cause it's not-
No, that don't count, because that's artificial.
Okay.
Yeah, that's artificial. Yeah.
Oh, I swear.
Usually when you see patients that are taking Clomid or any type of injections to get pregnant, you see that them getting multiple births because there's so many eggs that are being produced. Normally, we don't release a lot of eggs. We normally just release one egg, and then whoever's the quickest sperm gets there, we have a baby. But once you have patients who have, like I know my nephew, his wife, the third time that they went through in vitro, had 17 eggs. 17. So that's what makes their not their risk, but that's what makes their probability of having multiple babies, because they have so many eggs.
How many babysitters have your kids?
We're having two.
Or two twins?
Oh, thank God, I was about to say
Yeah,
she's
we're
about to
having
be a gumball
twins, a
machine.
baby boy and a baby girl. Yay. After 3 times of in vitro.
That's a lot of
3
money.
times.
One of my coworkers had a natural triplets.
And that's so uncommon. I mean, that's very, very uncommon. A natural without any type of extra medication to assist.
When she told me, I was like, what? She said, I need 3. She was one right after the other. She said, no.
Yeah, they're like, yeah. My dentist, or my former dentist, had 4. Yeah.
That's weird. I'm in the doctor's office and I figure out that I'm having more than one baby. What am I doing?
That is so
I feel like Stevie.
Yeah, that's so great. And I just have to give it to God, you know what I'm saying? I mean, I have no explanation whatsoever. I know what fertilization means, I know what, but when you get that kind of stuff, I just have to say, that's the Lord, I don't know what else.
Phil's was like 2, and he has Down syndrome, and then they got pregnant unexpectedly, and it was with identical triplets.
Wow.
And that just shows you genetics play so much in pregnancy and what happens. All right, so we've got our little twins, and then on our fraternal, I've got 2 different little sperm and 2 little ovums, and then they're developing different. All right, let's look at the placenta. I have so much time.
I have a question. You said that identical twins are genetic and they usually skip a generation.
Yes, I usually skip one.
What, is it the same with fraternal?
I don't think so. I'd have to research that. Well, if it skips a generation, it will be your kids.
That's why I be on the woman's side.
It's on the female side.
Oh, I don't know
We're
what.
having 2 eggs.
I'm not a geneticist.
Like, there's, you know, the little, like, wives' tale or whatever, that you hold a needle or a pencil. Okay, well, on me, it shows that I'm going to have fraternal twins, 1 boy, 1 girl. But I know nobody in my family who has twins whatsoever. So with fraternal, I guess it skipped, like, bukus of generations.
It might.
Holy cats.
I don't know. Y'all are asking me all these, I'm a nurse. I'm not. I don't know when. I just know how they reproduce and all that kind of stuff. All right, the placenta. The placenta is an amazing, amazing organ. It does so many wonderful, wonderful things. It is, it's responsible for metabolism and nutrient exchange between mom and baby. There is no blood that changes between mother and baby. There's no blood that exchanges. It's all through the placenta and all through the 2 arteries and the 1 vein. Of course, it begins to develop in 3 weeks. And where it attaches, we ideally want the placenta to attach higher. Okay, higher. Some higher in the uterus. But sometimes it doesn't. Sometimes it does in the lower segment of the uterus. And then I'm not going to go into all the things that can happen when the uterus or the placenta is low lying. because Miss Word will get mad at me if I teach all her stuff. So it implants, and where it implants is where it stays. So once it goes there and starts to implant, it's gonna stay there. The only thing that happens with it is that it gets larger. Does that make sense? It gets larger. It sort of grows out this way. So if you've got your uterus, you know your uterus looks like a pear. So when it comes in, ideally we want it to implant like right up here. And then it starts growing like this. So it's going to grow on the lining up here, the chorion and the amnion. But sometimes we can get it implanting here, and it starts growing here. And what is this right here? That's bad news, isn't it? This is the cervix. This is how the baby comes out. And the baby be delivered this way. No, so automatic C-section. Okay, so we've got to, throughout the pregnancy, it is vital when the patient is getting their ultrasound to find out where that placenta is as far as the implantation, because if it's down here, then I can't deliver vaginally. I have to deliver via C-section.
Is it dangerous if the water breaks and the piece of
Absolutely. What would there's lots of problems that can occur. If this placenta, if the mama's water breaks and this placenta comes out, the baby will probably die.
Really?
Because you can't get the baby out. You can't get the baby out because what's going to happen is that placenta is detached from the uterine wall, which there's going to be no supply, no blood supply to be able, even though the cord's still intact, it gets its nutrients from the chorion and the amnion and from the vessels, and it's not attached to mama, so we're going to have a big problem. So do you see why mamas that have low-lying placentas are watched very, very closely? The slightest bit of blood, the slightest bit of any pressure, we've got to get them in. Yes?
I know someone who their placenta or something it detached. How does that happen? Like what causes that?
A lot of times what we see is, did you hear a question? What happens with the placenta detaches? That happens at, first of all, that's a medical emergency. It's called an abruptio placenta. And basically what's going to happen is that baby's going to bleed to death inside utero. So when that placenta detaches, and no, I do not have an absolute cause of why that would happen, but generally what happens if I have a multi-pregnant woman, i.e. she's been pregnant a lot, and that uterus has been stretched out and went back together and stretched back and went back together, into where the uterus and the placenta just cannot get along, and it just detaches. And what happens is the baby starts to bleed. The mom starts bleeding inside utero, and the baby's going to end up dying.
This lady, this was her. Well, she ended up having another baby, but this would have been her third child, and she had children spaced out. I think she was older, and the baby, she had a normal pregnancy, and then I think she went into labor or something or another, but by the time she got there, something about like it detached, and I've never heard of that.
And the bad thing about it is it sometimes happens so quickly and we can't intervene.
That's what happened with her, and it was a completely formed baby. I mean, and she died.
I will tell you, in my labor and delivery experience, I've had 2 abruptions like that, and we saved both mama and baby. The mortality rate for mom and baby for an abruption is generally 99%. So it's very, very, very high. The bad thing, bleeding is never good in a pregnancy that's later. Especially, but the thing with an abruption is the abdomen gets hard and doesn't relax. It stays like a board, and lots of blood. So yes, it is very, very dangerous. So I've got to watch that mom and educate that mom on making sure that they understand. There I go, I'm going to labor and delivery. This is where they don't have to teach you nothing. All right, so let's look. And I'm hoping that when you go to labor and delivery, I truly want you to look at a placenta. Because it's really neat to start, you've seen it in the classroom, we've talked about what it does, but there is a maternal side to the placenta, and there is a fetal side. I want you to look at it because with the mom side, that's what's being up against the chorion. Okay, that's what's being the implantation. We call it the dirty Duncan, and I will tell y'all this. I thought this was the craziest thing, and I remember this when I was in nursing school. But I could never understand. I mean, I can see why they're saying it's dirty Duncan, but why would boards use those terms? You know, just maternal side would be good. But guys, I'm seeing that on NCLEX questions about the dirty Duncan. So I don't know why, but this will be a term that you might see on boards. But remember, it's very dirty, and the way I think about it, and not that it's so much dirty, but I look at the blood supply. Look at all the stuff, all the capillaries, everything that has been attached, and that has been assisting in that blood and nutrients given to that mom or that baby throughout 9 months. I just think that's pretty amazing. Way to play with it. Who's playing with a placenta? Yay! I want you to get your gloves on and get in there and play with it. It's really, and look, this is what has helped maintain this fetus through that 9 months. I just think it's fascinating. I just think it's just amazing.
Okay, so I've never like seen birds or anything like that, so I'm kind of confused about whenever you like deliver this thing. Is it like is it like painful for the mom, like the baby?
Yeah. Baby, it's not as painful as the mom, but you'll deliver the baby, and then after everything starts clamping down, you have to deliver the placenta as well. No, it doesn't feel like the 9-pounder that you just shot out of there, but it does. Your uterus has to contract, and the placenta. And the biggest thing that you've got to remember when delivering it is you have to make sure that that placenta detaches on its own. There is a time frame that you've got to, it sometimes takes 30 to 45 minutes for it to actually detach. What's really, because if I start pulling on it, I'm going to cause my mom a hemorrhage. And you'll see a lot of surgery. I used to work with OB/GYN, and he would take hemostats, and he would roll the cord up and start yanking. And I'd say, Schimmel, stop. It's only been 4 minutes. You know, stop it. You know, give it that placenta. Can y'all imagine me being a nurse and telling doctor?
I saw a lot of that.
It's gonna detach when it's ready to detach.
No, I'm talking about the nurse telling the doctor.
Oh, you still up?
Yeah, because the baby's monitoring. She was having contraction, the baby's heart rate's dropping. The nurses are like, hey, she needs C-section. He's arguing. Like, 5 minutes later, he comes running around the corner. He's like, she needs a C-section right now.
Absolutely. They don't listen to us. They don't listen to us.
All of the doctors who I've seen at work, they're always pulling it out and like tugging and pulling it out.
Stop!
Does it not come out whenever the baby comes out?
No, it does not come out when the baby comes out. The baby's delivered, and then it takes it a while for the actual placenta to detach on its own and then come out.
Once your body realizes.
Your body realizes.
It's like just the ass.
With a C-section, they take it. Yes.
Babies they take it.
Some people do that. Her question is, do moms usually eat the placenta?
Some
I
people
have
do.
heard of different cultures that do that. I have not personally witnessed anyone,
Did you donate your
female,
placenta?
that has a
You can freeze it as well.
I've never. Yes.
first bundle check, and she was like screaming like in more pain than usual for the first bundle check. And then she had another contraction, and there was another placenta. No one knew, like no one saw it coming. They like went to push down, and she was like, "I'm still in pain."
Yes,
and there's
she
a
had
placenta, yeah.
fetal demise.
But no one ever, they looked and said that, all I know is that they said that there was no evidence of another baby ever being in there. So, she thinks it's in my ovary. She told me she read an article that the other baby like could absorb it into their ovary.
Yeah.
So she told me to go get checked. So funny.
That is cool. All right, we'll have to scoot. I mean, I know a lot of people's got lots of stories about pregnancies and stuff, but that is one of the things that I answer your question about letting it detach on its own, because moms can bleed, and just let them deliver it by themselves and let their uterus start contracting down. So we talked about mom's side, which is very dirty dungeon. And then on the fetal side, which there's the chorionic villi and their circulation, and it's shiny and gray, and it's called shiny Schultz. And then there's a picture of the shiny Schultz. And I think it's really, really neat that you can see how distinct these vessels are, and all of that blood supply that's going in. The other thing I want you to look at is when the baby's born and they cut the cord. I think I said this a while ago. Look for the two arteries and look for the veins, because at every delivery when they cut that cord, they look to make sure that those veins are there, that vein is there, and the arteries are there as well. But I think this is just an amazing thing, that something like that can help send nutrients and oxygen to a baby and let it grow. I mean, I just yeah, we were all hooked up to one of those.
The way I personally remember that is it looks like the tree of life in Celtic culture. And then when I was in EMT class, my instructor said it was like the juice box.
Absolutely. I mean, it does. I mean, and that's why I want you to look at the big vessels, because of all the circulation you can see that goes in there. I just think it's amazing. Yes. And you can't really see the Wharton's jelly on that so much. Alright, when we talk about the placenta, what it looks like and all that good stuff, but there's also functions of it. I think I said a while ago, metabolic is one of the biggest functions that the placenta has. And it does produce glycogen, enzymes, so it really works on our insulins, or the baby's insulin. And it breaks down epinephrine and histamine, and it stores glycogen, and it stores iron as well. So one of the things with moms is it pulls a lot of iron from mom. So mamas sometimes have a decreased what? Hemoglobin, absolutely. So you've got to watch that mom throughout the pregnancy, because that baby's going to pull that iron. And what do you think is supplemented while she's pregnant? Vitamins. And sometimes if that hemoglobin is low, we may have to give that mom additional iron, because that baby is going to take that iron and that hemoglobin's going to be low, and we got to make sure that she's getting what she needs as far as perfusion. Because I can tell you, these little boogers take everything from mama. Mama's going to be the one suffering, so I got to make sure that she's not suffering with her nutrients. It also transports the water, the oxygen, CO2, electrolytes, and drugs. You've got to remember that drugs cross over that placenta as well and are given to the baby. So we have to be very, very careful. And when I worked in labor and delivery, I used to have a drug book that was specific for pregnant moms. Could they take this while they were pregnant? So we have got to, as far as antibiotics or anything to help their bowels move, I always, if they called on the unit and said, hey, I'm such and such weeks pregnant, I'm having problems with my bowels, what would you suggest that I use? I had a book that I could look up that was safe to be able to give to moms that are pregnant. So when you're looking up your drugs, especially on a pregnant mom, you need to make sure, because in your drug book, it tells you don't take with pregnancy. Okay? So you've got to make sure things cross over that placental barrier and that baby gets. I mean, obviously I shouldn't tell you to not drink alcohol or don't snort cocaine because the baby's, but some moms still do that.
I was in labor and delivery, and I didn't know if this was true. They said that if you give, as their labor's induced, if you give them medicine during a contraction, does it mean that it won't affect the baby as well?
Some of them won't.
Okay.
Some meds, like Stadol, goes straight to the baby. It has a short life to it though, but it is gone to the baby. So what you'll generally see is my baby's going to sleep on the monitor. It's like not moving a lot. That's why when we put when mamas have to have an emergency C-section, I put the mom out, I have 5 minutes to get that baby out. Because if I don't, that medication is going straight to the baby, and if mama's asleep, baby's asleep. So that's why we want to keep moms awake for C-sections. Unless it's an emergency situation, that baby's gonna die, then I need to get that mama and I need to get her under and get the baby out. I got 5 minutes. Okay? So because that medication is gonna cross that barrier and that baby's gonna suffer the same as I'm giving mom.
The lady that had the triplets in her second trimester, she was in a lot of pain because they were breaking ribs and stuff. So she went to the ER and they gave her morphine.
Obviously, they didn't have a book that said, they looked at the book to say, or the drug book to say, don't give during pregnancy.
So she figured it was all right because the ER.
Sometimes I'm just like, I can't believe nurses don't look at their drug book. Why do we not have it? Why do we have a drug book? And how many times have y'all, those of you that have seen me, said, wait just a minute, I don't know this drug. I gotta go look it up. And I'm not gonna give something I don't know.
So, like with my insulin, goes to take insulin at 8.
Yes, it could. But there's a lot of moms, and we talk about this gestational diabetes, and babies get, mamas are only a diabetic while they're pregnant, so they have to give insulin. What in turn happens is it makes a big baby. That's one of the biggest things that's problematic when you're having gestational diabetic is that the baby gets lots and lots of nourishment. But I've got to maintain your blood sugar too, because if I don't maintain your blood sugar, then you're not perfusing correctly, and that baby's not getting the nutrients. So, yes, gestational diabetics have big babies, and I'm talking 10, 12 pounds.
So for diabetic drug insulin,
She's not gestational. She'll be diabetic, insulin-dependent diabetic, but she's not gestational. Gestational just means that only with the baby. You were not a diabetic prior to, but you're a diabetic now, and that you're gonna have insulin, and you're gonna be monitored very closely.
so is that what they say a lot of diabetics get C-sections?
Absolutely. Did you hear what her comment was? Lots of diabetics have to get C-sections, and it's because their babies are macro. They're huge. I mean, huge. And for little tiny like you, yeah, you're gonna probably end up in a C-section. But you've got to think about you. You can't deliver in that baby. you, as small as you are, you can't deliver a teen-pound baby. I mean, that's just. All right, and see, we have endocrine, so the hormones are vital for the patient, so it works with the hormones. Our placenta does that as well. All right, I have listed these hormones for you. These are hormones that you have got to know.
I'll just walk through it one way on the screen.
Where'd you go? I don't want to get into the field circulation today, field circulation, so a brand new start. All right, I can still remember learning these when I was in nursing school. I guess it's because I was interested in it, I just got real excited. Hormones that have got to be, in order to maintain that pregnancy, these hormones have to be present and working. HCG, I know lots of you have heard HCG. When you have your pregnancy test, you know, the little pregnancy test, you go to Walmart and get one and you pee on it, and it tells you, well, there is testing for the hormone HCG. Human gonatropic, chorionic gonadotropin. That is HCG. Another thing that, I don't know if y'all ever went to any weight loss places that they gave you injections. That is the hormone that they give you to help you lose weight. I don't know that it works, but I've tried it. For me, because I ate 15 M&Ms, 15 bags of M&Ms every day, and it worked. But one of the biggest things
So
this
is
does,
that why when you first get pregnant, you're eating like skyrocket?
absolutely, because of that hormone. It's got a lot of estrogen and progesterone. We think progesterone, we think about man, right? I mean, we got it too. And that, we've got to have progesterone to maintain that corpus luteum, which that is the inside of the uterus, and that helps grow the chorion and the amnion. So I've got to have those two, the HCG. It's also, when you're pregnant, those levels start to elevate. So if you start having some signs and symptoms of maybe I'm not carrying this baby very well, maybe I'm having some bleeding, maybe some threatened losing the baby, what they will do is they will take your blood and they will check for HCG. Because as you're pregnant, that level goes very, very high at the beginning, and then it starts leveling out. Okay, so we want it to maintain that, to make sure that we can maintain the pregnancy. I.e., let's say that, another example, if you go and you know that you're pregnant, or you thought you were pregnant, or you're pregnant, we'll just make you pregnant. And then you go and you start like having a lot of cramping, and then they notice that your HCG levels are not going up. And so what that means is that the fetus is not surviving. Because if that HCG level has not gone up, you cannot maintain a pregnancy. So you are either going to miscarry the baby, or, so, and that's how we make a decision on, because sometimes that's so early that an ultrasound is not gonna tell me, because it's so small. And sometimes you lose the baby, and that tells you if your levels are not high or not.
She said we can increase hunger, right?
So HCG is a very important lab that they watch while you're pregnant, because it helps maintain the pregnancy throughout. HCS is that, why do they not have things that are like easy to say? Human chorionic somatoma ametropy. HCS. That is also similar to the growth hormone, but it works with fetal growth and lactation development after the baby. So you're not going to see those levels being elevated throughout the pregnancy. You're going to see those levels towards the end of pregnancy, because we're getting the breast ready for lactation and get the breast ready for making a milk. Okay, so those are another two. Progesterone, like I said earlier, you've got to have that present in the endometrium. So it's got to develop that as well. Progesterone also helps with the contractility of it, of the uterus, because the uterus is a muscle. It's going to contract and release. Does everybody know what a contraction, when I say contracting, it's when the muscle actually tightens up and then it releases. So the progesterone is going to help that. And what happens, you're like, well, I don't need to know. I don't want it to contract early. Well, believe it or not, the uterus starts having what they call Braxton Hicks. A little over halfway through the pregnancy, mamas are going to start feeling some tightening in the uterus and releasing. And what I usually explain to mom is that what it's doing, just think if you were going to run a marathon. Okay? How many miles is a marathon usually? 26.2 miles. Okay? Because like giving birth is like running a marathon. Okay? So, do you just go out there the day of the marathon and get ready on the start line and take a piney and run 26 miles? No. I'm gonna be dead at the first mile, and I'm never gonna make, so the uterus is the same way. It's got to train for the big birthday party. So there's a lot of times that it'll contract in between. The thing that's concerning is that it was a continuous thing. Because usually Braxton Hicks just happens sporadically with no pattern. And there's really moms just might say, oh, okay, I'm better. Just sort of catch you off guard. And it's getting ready for the big birthday party. So let mama know that and it also is reassuring to me that progesterone is working. Because that uterus is starting to contract. And we'll talk more about preterm part of it in just a little bit. But it'll start about 21 weeks. Start getting ready for the birthday. All right, maternal estrogens, they actually, they're like steroids, is what they are. Because that baby is, the uterus is getting bigger, the breasts are getting bigger, and so it needs to help with the hormones, and it increases vasodilatation. With everything getting bigger, so it helps the vascular system dilate so we can get more O2 to these big areas. So those are the hormones that are used for us to maintain pregnancy. All right, questions? I'm not going into fetal circulation yet. I don't know why they gave me so much time.
So is that it?